2018 was a big year for advancements in cardiac arrest care. We saw many survivors reunited with crews, an emotional honor for everyone. JFK Medical Center also recognized our crews at a large event this past year with survivor story after survivor story. And there's more to come as we keep getting better at saving lives. PBCFR ROSC, return of spontaneous circulation, is currently double the state average, with rates ranging from 32% to 40%, something to be extremely proud of, and we at Palm Beach County Fire Rescue are taking that even further.
We train hard, we care, we're professionals, and when people watch us do what we do, they actually say, hey, these people know what they're doing.
The Medical Services Division just hosted its first cardiac arrest symposium, bringing in experts in the field together to learn from each other.
The whole purpose of this symposium is to increase neurologically intact survival rates after a cardiac arrest. So ROSC rates is not just enough. A ROSC rate is great, but if they don't leave the hospital neurologically intact, it doesn't really do much good. So from the beginning of the symposium to the end, every speaker, the focus is on how we can increase our neurologically intact survival rates.
PBCFR also started the RICH trial over the summer at 3 stations in Battalion 10. RICH stands for R, rescue pump, I, gel, C, continuous compressions, and H for head-up CPR.
If you tilt the patient up a little bit, the venous congestion blood in the head will come out because of gravity, and that dramatically lowers the intracranial pressure and allows that much more forward blood flow to the brain.
Our medical director, Dr. Kenneth Shepke, says our pilot study data is promising so far.
We've gathered enough data now to say that there's something to this, that's as good as we were, which we're already really, really good. This stuff, combining things together, seems to be even better.
Pediatric Medical Director Peter Entebbe says we've also seen a shift in pediatric cardiac arrest treatment.
The whole culture has changed, right? So the culture meaning that when we get to the scene, within minutes, we're bagging, we're pushing on the chest, we have a drill, we're giving epinephrine, and parents are looking at us saying, you're staying here? And we look at them and say, yeah, we're staying here.
PBCFR is also the lead on a new cardiac care collaborative with community partners, the healthcare district, the STEMI hospitals, and other healthcare experts in the community.
We're going to look at everything from beginning to end, and it's going to include bystander CPR and dispatch CPR instructions that they're given. It's going to include the EMS personnel and the protocols we follow. It's going to include the care in the emergency department, include the care in the hospital after the patient is discharged from the emergency room and is admitted to the hospital, what type of care they're getting. And then finally, it's going to include survivor support after a patient is discharged.
Overall, Palm Beach County Fire Rescue responded to 136,000 calls for help to 911 for the last fiscal year ending this past fall. 117,000 of those were EMS calls. And it was time for an EMS protocol book revamp, a significant one. Over the past year, Captain Charlie Coyle, along with a group of people who had just finished studying for the EMS captain's test, spent 8 to 10 months totally revamping the EMS protocol book.
They knew the book in and out. They actually knew the book better than me, and I was actually the one that authored the book the first time. So they had great suggestions, and we were able to take them all and put them into play and use some of the evidence-based medicine and create a new document that's extremely user-friendly.
The biggest change was recataloging everything and making sure what you need to know about each protocol is actually on the same page instead of being split up in different sections.
We took the pertinent stuff from the pharmacology section and actually put it into the treatment. So if you look at the protocol book now and you look if there's a certain medication you would give, if it's contraindicated or there's a precaution associated with that medication, it's now right there for you on the protocol page.
The group also worked to streamline the wording and standardize and color code the text boxes, with warnings now in yellow and all info in gray boxes. There are many new changes, not only in cardiac arrest protocol, but also sepsis protocols, based on the latest cutting-edge data from our medical directors.
We've went into an area in sepsis care where we're actually administering antibiotics. So we're doing stuff that the hospital does after the patient gets to the hospital, a few hours after the patient gets to the hospital, and we're doing that right there on scene. So that's something totally different for us. It's really just raising the bar for pre-hospital emergency care, and it's making sure that our patients and our citizens get the best care possible and as quick as possible.
A big thank you goes out to all of the doctors who contributed, but also to all of the employees who were involved in working through this long process, including input from Recruit Class 70, the Paramedic Development Course number 11, and the ODA class number 35. Expect a lot of new medical equipment coming your way this year. New scoop stretchers are already being used in Battalions 1, 4, and 7. They can be ordered through battalion chiefs.
The new scoop stretchers are plastic. They're green. They're much easier to use for the crews. The old ones, the metal ones, as crews out there know, have been around forever.
The ventilators and suction units are being switched out with newer models. In the next 2 to 4 months, you'll see new medical bags and trauma bags in a new backpack style. They've already been field tested and modified.
We've been putting these out in the battalions in certain areas over the last year, and the crews have modified them, changed them, and this is the design that will be coming out has been tested by the crews in the field, and that's what they approve of.
And new pediatric bags.
In each pediatric bag, there's going to be a hand-heavy pouch that is going to be age-dependent, and so a medic on scene can just pull out the pouch that is appropriate for the age of the patient they're working, and all the equipment will be in that pouch.
There are also new rapid trauma bags purchased in part by a grant. They are currently in each seat for Battalions 2, 7, and 3, but the plan is to purchase one for every seat in the county. The Medical Services Division won 2 high-profile awards this year for our revolutionary MIH program, working with high-frequency 911 utilizers. First, the National Association of Counties Award.
We ran a pilot program for approximately 9 months to determine whether or not going into the home and following these patients, providing biopsychosocial assessment, evaluating their needs, their total system, not just medically, also financially, emotionally, what was going on in their environment, their family unit, whether or not that could help reduce their reliance on EMS and get them to the right level of care.
And second, the Golden Palm for Captain Jessica Banks and social worker Lauren Young, awarded for making the MIH pilot program a permanent part of our care.
In a time where I think a lot of fire-based EMS agencies and EMS agencies in general are trying to find ways to not only address high-frequency use of EMS, but how to really get to the challenges that these people are facing so that we can help them. Because at the end of the day, that's what EMS is all about. It's about helping people, finding solutions for them.
Crews are referring an average of 200 patients a month from the field to MIH.
Keep sending in the referrals. If you have any question at all, should you send in a referral, send in the referral, and our MIH team will look at the referral and determine what needs we need to do. Sometimes we go out there, but sometimes it's a simple phone call.
Out of 1,500 MIH patients over the last year, the numbers show a 55% reduction in 911 calls from one 6-month period to the next.
What makes our program different and our program revolutionary over other programs is the use of social workers. A lot of fire departments around the country, they'll contract out with outside agencies to provide their social work. But we're fortunate here in Palm Beach County Fire Rescue that we've hired our own staff to be our own internal social workers, and that's been the real difference in our program. And now we have departments from around the country coming down to us to visit our program to learn about what we're doing.
It's really exciting for Palm Beach County Fire Rescue to be recognized by Palm Beach County because it is definitely an innovative model, and I think shows that Palm Beach County Fire Rescue wants to be on the cutting edge, not just in terms of what we do to attack fires or navigate medical emergencies, but also to help people beyond those 911 calls and assist them in their everyday life when they're struggling to navigate chronic disease management issues or challenges in their world that are causing them to utilize 911.